If you are thinking about having bariatric surgery or you're just about to have weight loss surgery and you're confused by all of the different rules that you hear different surgeons telling patients, I get it. It's all over the map. You might hear somebody say, "Oh, my surgeon said I can have soda after surgery." And others of us are going, clutching our pearls. It is all over the map. Today, we're going to talk about why surgeons have different rules for different things and what it means for you and your journey. My name is Sean. I had a mini-gastric bypass in March 2022. I've lost 140 pounds or 88% of my excess weight. I'm also a health journalist, and I help people who are having bariatric surgery save time and money as they're planning their surgeries. So let's get into it. Why do surgeons have so many different rules, and why doesn't everybody have the same guidelines? Let's start with the most common one that you'll come up with is the pre-op diet. And this will be one of the first things that you encounter. If you go on, say, a Facebook group for bariatric surgery patients, you'll see that people have different guidelines for their pre-op diet. Some people have to be on a liquid diet for weeks before their surgery. Some people don't have to be on a liquid diet and they can eat solid food right up until 2 days or even 1 day before their surgery. What gives? Why the difference? There are a couple of factors at work. Number one, it depends on how much weight you have to lose, what your current health is, how fast you're trying to have surgery. Also, the surgeon's comfortability. So most surgeons will tell you they want you to lose weight before surgery to shrink the liver, so that way it's easier for them to move because the liver sits on top of the stomach and they're going to have to move the liver to get to your stomach to do the procedure. And it's also safer. Like, they don't want to nick your liver and then cause some problems. So my point of view, if the surgeon needs me to lose a couple of pounds so they can do a safe procedure, I will lose it. But you might wonder, like, what else? What are the other reasons why some surgeons will say, I need to lose 5% or 10% of your body weight, and other surgeons are like, just don't gain any weight and we'll be good? The science about losing weight before surgery is all over the map. I just looked at a review of literature, so a review of medical studies. This was a review of 15 studies. 5 of the studies said that there is a long-term positive benefit for long-term weight loss for people who lose weight before they have bariatric surgery. And then of the 15, 5 of them didn't find any benefit at all, and only 1 found a negative benefit. So there's still a lot of controversy. In terms of safety, mortality, there is research that shows that if people lose even just a small amount of weight before they have bariatric surgery, like say 5%, there is a lower mortality rate. That same paper also said that goals for weight loss before surgery shouldn't be time-based. So, for example, some insurance companies require that you be on a pre-op diet for a certain amount of time. This paper, which was a commentary, said that it really should be based on a particular goal, so like a percent goal, like 5%, instead of just arbitrary amount of time. Okay, so that's the deal about pre-op dieting. Let's talk about another one, what you can drink after surgery. Alcohol is definitely out. Most surgeons recommend that or dietitians recommend that you avoid caffeine after surgery. This is because caffeine can interfere with your body's ability to absorb calcium. And remember, you want to get the nutrients that you need to keep your body well nourished. So, and calcium is one of the big things that we have to watch. So a lot of surgery centers recommend that you avoid caffeine. Also, caffeine is a mild diuretic, and especially right after surgery, when you're in that zone where you're really at high risk for being dehydrated, you want to avoid things that are going to further put you at risk for dehydration. So they want you to stay away from caffeine for at least that period of time. Okay, here's the big one. Soda and carbonated beverages. Some surgeons say avoid carbonated beverages for 6 to 12 weeks. Some surgeons say avoid it for the rest of your life. Why? What's the difference? What's going on? Number one, the thing is that carbonated beverages can make you really feel uncomfortable. Like, they make you feel bloated and it feels like there's pressure going on. Some patients worry that drinking carbonated beverages are going to permanently stretch your pouch or sleeve. That's not true. You'll have temporary expansion because of the gas, but it doesn't permanently stretch or damage your pouch or sleeve. One of the big concerns that surgeons and dietitians have are drinking sweetened sodas. We all know sodas have a lot of sugar, and then because you have to separate eating and drinking, you can't eat anything while you're drinking all that sugar. That's not good for your system. So they want you to avoid sweetened sodas. Some dietitians and surgeons also want you to avoid artificial sweeteners because there's different controversies in science around whether or not they can impact your health in a negative way. The other thing is that there's been concern that carbonated beverages can inhibit your body's ability to absorb or use certain nutrients, but there's not a lot of evidence showing that that is in fact the case. So that's what's going on with what you can drink in surgery, especially carbonated beverages. All right, if you've heard any of these rules that I've mentioned so far, or you've heard variations, drop a note in the comments and let me know what those are. I would love to see what other patients are being told by their surgeons. Not that anything's right or wrong, but I'm just curious, like, what the spectrums of rules and timelines are. And I think it's good just for all of us to have a community where we can kind of compare notes. So drop a note in the comments and let me know what you're being told to do. Okay, we've talked about what you can drink. Now let's talk about how you can drink it. The rules around straws. Some surgeons say avoid straws for 4 to 6 weeks after surgery, and some surgeons say avoid straws for the rest of your life. The thinking is that you'll introduce too much air into your stomach after surgery if you drink from a straw. Some surgeons want you to avoid that while you're healing, so that's why there's like a 6-week rule, and then after that they might say, okay, you can drink out of a straw. And then some surgeons are concerned about that being a lifelong issue, and it really kind of depends on the patient's health, but that is what's behind the straw rule. Now let's talk about another rule. This one really got me because I love tomatoes. No tomatoes after surgery. Some surgeons say avoid it just for the 6 weeks or 8 weeks or 3 months after you have surgery. I've heard of a surgeon who said avoid tomatoes for a year. I don't know if I could do it. I have to admit, I love tomatoes. And then some surgeons don't really have a guideline around it. The concern is that they don't want to impede the healing process. And I've seen some lists that specifically called out tomatoes and then maybe fruit, but then there are some acidic things that kind of fell through the cracks. Like, I saw a list that mentioned tomatoes but not tomatillos, or didn't mention vinegar even though it had lemon juice and lime juice on the list. So it may just be some things falling through the cracks, but basically the thinking is they don't want any acidic foods to interrupt the healing process. So that's the rule around tomatoes and sometimes fruit and other acidic things. Now let's talk about timing between eating and drinking. This is another thing that's all over the map. Generally, to make it easy, a lot of surgeons give you a 30-30 rule. You can't drink 30 minutes before you eat, and you can't drink for 30 minutes after you eat. Did I say that right? And then some surgeons have a 15-30 rule, so 15 minutes before you eat, 30 minutes after. And then I've heard of a 20-20 rule, 20 minutes before and 20 minutes after. The real thing is that you just want to, the reason why they have this time period before and after is because they want to give your food time to let you experience satiety or a feeling of fullness. So my experience has been, my surgeon's rule is no drinking 5 minutes before I eat, and then no drinking for 30 minutes after I eat. I haven't had a problem with that. Number one, 5 minutes is not very long before, and it makes it easy to take any like medicine that you need to take with food. I think that's important. And then for 30 minutes after, and usually like surgeons that have like a longer period of time to wait between drinking before you eat, they will make an exception. Like if you need to take some medicine with food, just have like a small sip. But ask about that if that's a concern for you. And then in my experience, I'm generally so full after I eat that I don't feel like drinking for sometimes 45 minutes to an hour after I eat. And the trick there is that you have to really keep an eye on making sure you get your hydration, because the longer period of time that you have that you're not drinking makes it harder for you to get your hydration goals every day. So really try to manage that, whatever window that your surgeon gives you or your dietitian gives you. Really think about and work on how you're going to manage getting all of your hydration. That's the real trick about the windows of timing, eating, and drinking. Let's talk about one last thing. Prescription medicines for weight loss. Some surgeons will use these before and after surgery if patients need it, and some don't. This is a big issue, and I think it's 2025 as I'm recording this. I think there's still some learning that has to happen, and I think that things need to shake out in terms of how do we go forward. But I will tell you that there are some surgeons who recognize that patients have trouble losing weight before surgery, especially if they require weight loss before surgery, and they will prescribe medication to help people lose weight before surgery. Some medications can be used short term to lose weight, and some medications are meant to be used long term for weight loss. So you'll probably have that conversation with a surgeon if they recommend or talk to you about taking weight loss medication to lose weight before surgery. Sometimes you'll have a medical condition and they'll prescribe a medication that can be used for weight loss that also can treat those conditions. And then some surgeons will prescribe weight loss medication after surgery. Some people have complex enough obesity, and keep in mind that obesity is a chronic disease. It's very complicated and has multiple factors. Surgery is still the most effective way to treat obesity, but surgery doesn't address all of the different factors, the biological factors involved with obesity. So sometimes people need both surgery and medication, and some surgeons recognize that, and so they will pair surgery with medication. And I'll produce another video on this. I'm thinking about how to approach it, but some surgeons will recommend or prescribe weight loss medication after surgery. In my case, I started weight loss medication about 4 or 5 months after I had surgery, but I also had other health conditions that warranted it, as well as managing obesity and my weight. Okay, so that's a list of some of the things that weight loss surgeons do differently. None of them are right or wrong. Again, as we've seen, sometimes the science is all over the map, and it depends on what the surgeon is comfortable with, what they've seen in their practice that they feel is effective, and it depends on the patient, and it differs from patient to patient. So again, nothing's right or wrong. The important thing for you to know is, if you're still interviewing surgeons, to really go in and ask some of these questions, like look at things that are important to you and ask about them, because this is going to be a partnership, and whatever guidelines the surgeon gives you, those are going to be the guidelines that have to fit your lifestyle for the rest of your life. So you need to find guidelines and a surgeon that's going to help you find something that you can live with for the rest of your life. That's really important, to find that lifestyle fit. Also with the dietitian, find that lifestyle fit. All right, so if you have any other guidelines that you've heard differing things about, please drop a note in the comments, because that will inspire another video and I can address it and look up the science and see what's going on and share that with you. If you are thinking about having bariatric surgery, I have a couple of tools that can help you. Number one, if you look in the video description, I've got a link to a website that I created. It's called the Bariatric Surgery Explorer, and it will let you compare different procedures. So if you're still thinking about what procedure might be right for you, you can read more about them and then maybe go have a conversation with your surgeon with a little short list of the ones that you think might be a good fit, and they can tell you more. And then the other thing is a cost comparison tool. So if you want to compare, say, a sleeve to a bypass, you can do that. And keep in mind the prices are ballpark. Every surgeon has their own prices, but this will give you a good idea if you have to pay out of pocket. And then also you can compare from the United States to Mexico to Turkey, so you can kind of explore medical tourism a little bit. The other thing that I offer is one-on-one support calls. So if you're planning your surgery and you want to save time and maybe some money, I offer one-on-one calls. These aren't medical calls. I'm not a medical professional. I'm not a therapist or a dietitian. What I do is I help you plan a roadmap to strategize your way to surgery. So I help you figure out where to find a surgeon. If you're planning to go overseas, again, where to find a surgeon, what to do if you need to make an insurance appeal, how you can finance it if you need to pay out of pocket, and some of the other logistics that help you plan. If I'd had this kind of support, I probably would have saved at least a year. It took me 2 years from the time I decided to have bariatric surgery to the time that I actually got into the operating room. And if I'd had some of this support, I probably would have saved some time and maybe some money. So if you think this will be helpful for you, look in the video description. There's a link to my Calendly, and you can book some time that works for you. We'll spend an hour together. I'll send you a recap of everything that we discussed, plus an email with some resources and some bonuses too. I wish you good luck on your surgery journey, and thank you for watching if you're still with me.